I'm Emily Mackler. I am the clinical pharmacist with the Cancer Center Symptom Management and Supportive Care Clinic. One of the best things you can do as a patient to make sure your treatment works as well as it should is by taking medications as they're prescribed. This sounds a lot easier than it may be. There are a lot of barriers to taking medications as they're prescribed. Financial concerns is one large barrier that we see with patients. In addition to that, the complexity or how many medications you're on can make it very confusing to take medications as they're prescribed or to remember to take all of the ones that you have. In addition, this can come into play when there are drug interactions, so that you have to avoid one drug while you're taking another one, and this can all become very confusing. Some patients also don't take medications as prescribed because they have concerns about the effects of those medications. One could be that they're concerned about potential adverse effects of the medications, and they don't believe that those adverse effects outweigh the benefit of taking them. Another reason could be that they're concerned, for instance, that they may become addicted to a medication. We see this unfortunately a lot of times in patients who are in pain and don't take their pain medications because they're concerned that they may become addicted to it. Finally, we see that age and memory can come into play when we talk about taking medications as they're prescribed, and the older that you get can make it more difficult to take them, one, because of your memory, but two, because it can become much more difficult to swallow the medications that you have. There are many tools available to you to help you take your medications as they're prescribed. One of the first steps that we work with patients on is to help provide a summary of all the medications they're taking, the reason that they are taking them, and then the best times of day to take them, and if there are any concerns with them. So for instance, some medications you've probably heard you shouldn't take with grapefruit juice. And so things like that kind of information is important as well. To enhance that, we also at times will create a medication calendar, and so some patients may be on therapy for 2 weeks out of a month, and having a calendar that helps to state when the start date is and the end date is important and helps them to take the medications as they're intended. Alarm systems are something else that's available to patients, and so some patients will receive follow-up phone calls, or if we know that therapy is to start a certain date, we can offer that we can call you and to remind you. In addition to that, some patients may set an alarm on their watch, for instance, and time it for the medication administration times throughout the day to remind them to take it. Pill boxes are very useful, and you may even use them already, but being able to fill a pill box for a week is something that can help make it easier to take medications if you're taking many of them, but it also is a nice visual cue. So if you're laying in bed at night and think, oh, did I take my evening dose, you can easily go to a pill box and see if the medications are still there or if they're gone. So that's a nice reminder as well. There are things that definitely are available to you within the Cancer Center that can help you with medication and how well that you take them. Clearly, if you have any concerns with regards to the side effects of your medications, talking to your healthcare provider is very important, as well as if you're starting to have trouble taking them for other reasons. For instance, if you're having trouble swallowing the medications, your healthcare provider may be able to help you by providing a different formulation of that medication. We have a practical assistance clinic that is available within the Cancer Center that can help you manage some of the financial concerns that are associated with your medications. And finally, we have a medication management clinic that you can set up an appointment through our Symptom Management and Supportive Care program. At your medication management clinic appointment, there are many things that we may do. First of all, many of the tools I talked about, we can help get set up for you. So in many cases, we'll provide a comprehensive list for you of your medications, the reasons you're taking them, the best time of day for you to take them. We can also provide a calendar for patients who are taking medications on an on-again, off-again basis. In addition to that, we provide pill boxes for you and can even fill your pill boxes for you on a weekly basis if needed. Some patients may come to us and do inquire about different formulations of a drug, and we can work with your healthcare provider about having a different formulation available if possible. We also see patients who are taking medications that aren't necessarily prescribed by the Cancer Center, or herbal products or supplements that may interact with your medications in a certain way. So we look through that entire list and talk to you about the best time of day to take those things, if they need to be avoided during any particular therapies, and we can provide a summary of that for you as well.